Warning, censorship. Warning, censorship.
I just got into a screaming match with border security, so this should be fun.
And you will respect all the other workers around here. Because
I did not
you're a nurse.
do any disrespect to any worker.
Look what you're doing right now.
I'm not doing anything.
Instead, they're censoring us. They're threatening to take our licenses away. The general public should be scared of that, not me not wearing a mask outside.
What's up, you guys? It's Andrew here, and we're here with Jess Faraone. You might know her as the viral nurse who refused to wear a mask, refused quarantining, refused testing at Toronto Pearson International Airport when she was coming back from Africa. So since this event happened, we'll call it, we've seen a lot of mainstream media come out against you. CBC, Blog TO, they've misquoted you when you said a couple things. They acted like you were being super serious when you called yourself a hero, first of all. Yeah. They're printing that as it was straight fact. What kind of backlash or response or positive response have you gotten from this?
I have gotten a lot of positive support from a lot of fellow healthcare workers who are just too scared to actually go against the mainstream because of the backlash that we're getting. I work in long-term care. I've worked in long-term care. I've worked in the hospitals, on COVID floors, and it's just not adding up. The measures that the government's putting in place is not being justified for what's going on in the long-term care homes and hospitals. It's actually doing worse in long-term care homes because people are dying without being able to see their families. They're being neglected. They're not being taken care of well, and that's why I've had enough, and I'm speaking out, and I'm not the first nurse to. There's many other nurses speaking out. There's many other doctors speaking out, and this dehumanizing cancel culture needs to stop.
So you were coming back from Africa on a volunteer trip to work in hospitals there. Was this the first time you went like maskless at the airport, or what inspired you to do this, or has this happened before?
This isn't the first time I've gone to volunteer as a nurse. This would have been my second time going to Tanzania to volunteer. And I went there to volunteer as a nurse, but also because they don't have any of this COVID culture that we have here. They don't have any mandatory masks, social distancing, or restrictions. So everyone was living completely free, while I was there. So it was amazing. And then the idea of having to come back here and be restricted and masked and censored and not able to speak my truth, it literally gave me so much anxiety. And I saw Chris Sky, who kind of stood up, and it went viral. And just based on him standing up, I was like, all right, fuck this. I'm going to stand up too. Like, it's time. I'm saying, like, enough is enough.
I just got into a screaming match with border security, so this should be fun.
And you will respect all the other workers around here. Because
I did not
you're a nurse.
do any disrespect to any worker.
Look what you're doing right now.
I'm not doing anything.
You know, it's crazy that I'm going to get my license. Well, people are reporting me to the College of Nurses when all I'm doing is trying to actually protect my patients, because what I'm seeing is an increase in depression, an increase in suicide, an increase in overdose, heart attacks, an increase in so many things. And yet our focus on COVID is this tiny, narrow lens. And it's just, I'm sick of it. Enough is enough.
So I wanted to ask, in some of the articles, they've been quoting statements from the Ontario Nurses Association. Have they reached out to you? They used language like, this is unprofessional. We don't think our nurses should be promoting lack of distancing, lack of masking. And you mentioned the threat of people wanting to get your license taken away from you. Have you heard from the associations, the unions yet?
I have not heard anything from the associations to date. I just want to clarify, as a nurse, I completely agree with PPE being worn in hospital settings when you're dealing with sick people. It's to protect you and it's to protect them, but I do not agree with walking anywhere outside in the general public with a mask. So why aren't Canadians willing to have an open conversation about the concerns that frontline workers like myself and other doctors who are working in long-term care homes, hospitals, doctors' offices, why aren't they willing to discuss what we are bringing concern to? That is my question, and that's scary. Instead, they're censoring us. They're threatening to take our licenses away. The general public should be scared of that, not me not wearing a mask outside.
A lot of the mainstream journalists and writers out there, they're willing to retweet the TikToks. They're willing to retweet the narratives of the hospitals are being overrun and we're on the cusp of everything breaking down. Why do you think so many people, writers and people in the politics, are not willing to speak on the other side of the story that people like you are giving?
I think it's simple. Maybe they're just not willing to take the backlash that it gets. But I'm a frontline worker. I am in the hospitals. I'm in the long-term care homes. And I am saying that the healthcare system is not crumbling because of COVID. It's crumbling for suicide, depression, heart attacks, all the other things that I've mentioned. So we need to have this open discussion. And it's just crazy that we're not having the open discussion.
Last question, Jessica, and I'll let you go. There is actually a film set going on nearby here. We won't say where, but what is your take on all the restrictions here in Toronto? Film studios are allowed. We've got different numbers for much larger spaces on capacity limits. What's your take on the restrictions in Toronto right now that just went back into the gray zone out of lockdown, as if that's a really cool thing?
How are a lot of other places living restriction free, yet we are so developed and there's so much science going on here that we are being locked down? It makes absolutely no sense, and more people need to question this.
Thanks for watching, guys. Don't forget to like, share, and subscribe. And if you get fined for one of these bogus COVID charges, you can go to fightthefines.com and we will fight it in court for you.